Good evening to our listening audience, and we're grateful to be back here with you with the Exercise Your Faith campaign. My name is Jonathan Hill, and I have the opportunity and honor of serving as one of the leads here in the Baton Rouge region. And welcome to the second night of, or the second series of our webinars as we talk about Exercise Your Faith. And tonight we're going to be talking about stories from the coronavirus. And so we have a very unique and diverse panel that's going to be joining us in just a moment. But really want to give you some context about Exercise Your Faith. It's an initiative to help get health care and better education to the vulnerable African American community in Louisiana. And so this campaign is really working with faith-based organizations, barber and beauty salons, and community medical professionals to help African Americans put themselves and their families, protect themselves and their families from COVID-19. But not just protect you from COVID-19. This campaign also seeks to provide nutritional education for healthier living and working to educate the community about health disparities and how to live a healthier life. But lastly, this campaign seeks to provide the community with a healthcare resource guide with medical professionals, clinics, and healthcare suggestions for people and their families. And so if you want more information about the Exercise or Your Faith campaign, you definitely can visit the website at www.exerciseyourfaith.org. And there you can sign up for updates and see the resources that are available to you. And so for those of you who are watching us on Facebook Live and or YouTube, feel free to share this live feed with your networks so everybody can be a part of this robust discussion we have planned for you tonight. And so without further ado, I want to bring up our distinguished panel. They will be joining us. And thank you, each of you, so much for joining us tonight for this discussion, stories from the coronavirus. And truth be told, all of us have a story to tell as it relates to COVID-19. And so we want to begin this evening with a round of introductions. If you will just introduce yourself and tell us a little bit about you, we'll begin tonight's conversation. So I want to begin with the roles among us tonight. Miss Nikki Nicole Scott, if you will introduce yourself, and then we'll go to Dr. Andrews, Pastor Domain, then Pastor Hardy. Maybe Miss Scott is having a little delay hearing us. Dr. Andrews, why don't you go ahead?
Sure. Good evening, everybody. My name is Dr. Ronald Andrews. I'm a board-certified physician here in Baton Rouge, practicing both internal medicine and pediatrics. I've been in practice 20 years here in Baton Rouge exclusively, in addition to running a telemedicine service. So COVID-19 has definitely been a part of my life, and I can't wait to get into the discussion.
Thank you, Dr. for being here. Pastor Domain?
Good evening. I am Errol Domain. I serve at the Elm Grove Church in the Mid-City area, more specifically the Park. Those of you who are from Baton Rouge are familiar, and just excited to be a part of this conversation tonight.
And Pastor Hardy, better known as Pastor Rowe.
Yes, I'm Pastor Rowe, and I serve as the lead pastor of All Nations Worship Assembly of Baton Rouge and also New Orleans. And for those who are in Baton Rouge, we are over in the Park Forest area. I'm glad to be a part of this discussion tonight.
Thank each of you yet again. We are going to try to get Ms. Scott back shortly. It appears she was having some technical difficulties. And so I really just want to start tonight with the question. First of all, how are you? And then how have you been personally affected by the coronavirus or the COVID-19 pandemic? We can start with you, Dr. Andrews.
Okay, great. First, I'm going to tell you what, Reverend Jonathan, I'm going to preempt all of y'all. For us to get out of this COVID, we need to pray. Because I'm going to tell you, all the medical science in the world, you already can tell we don't know. And it's not that we don't know some of the things of what we need to do to try to keep people safe. And we're finding therapies, obviously, to help them get better. So that is improved. But I think for this pandemic to end, his prayer is what's going to be the answer. Because it's going to be over when God wants it to be over. The bottom line, ain't no election or no vaccine or anything like that that's going to do it. Personally, I would say the thing that would amaze y'all about being a doctor during COVID, it definitely upended me, my life personally, and other healthcare professionals. I'm self-employed and my office is still running and everything is doing great. But if you look at it closely enough, there are some doctors and nurses who have been laid off and furloughed and so on and so forth because so much time, effort, and energy has been put into COVID. But then the people that are supposed to come for their regular blood pressure, diabetes, or wellness checks, have canceled out of fear. In my personal life, I'd say it's two things. I was on a Zoom webinar earlier today, and I know I was exposed early on to it. Unfortunately, I didn't get it, but I was exposed early on right after Mardi Gras, before we knew it was in the Baton Rouge area. So I'm going to say in the doctor's office, what is done is kind of maybe about 4 or 5 subsets of patients. So probably if I say there's 5 subsets, 4 of them think they got COVID. So it's either I think I got COVID, I really do have COVID, I had COVID, and then unfortunately we're finding out there's some people who are long haulers. So like they have COVID and maybe in the 2 weeks or so they get better, so to speak. But then on the flip side, they have lingering coughs, chest pain, shortness of breath, numbness, and tingling that really has not been able to be explained medically, other than maybe it's some inflammation left over from the virus. So what I'd say with my life, so that's the 5 subsets of patients, that you're dealing with. On the flip side, the last one, the 5th one, is people who are too afraid to come in. So they need to come in and check on their diabetes. You're hearing stories of people having heart attacks, or they needed emergency surgery and they may have, unfortunately died. Surely they're sicker because they're afraid to come in because they don't want to come to the doctor's office or the hospital because they're afraid to catch COVID while they're there. So it's a little different. So in my own office, we usually are open from 8 to 5. What we had to do probably for several months, at least until school got started in August, we cut back from 8 to 3, really like 2:30 to 3, because what we found out was it was less patients because of probably that 5th subset of patients that they're afraid to come in. But on the flip side, we didn't need late afternoon appointments because people weren't at work. They weren't going to school. No one had to rush to get the child from school or make it to the appointment in time. So we found out what would happen was when we opened up in the afternoon, we get a few after lunch, and then it'd be those 2 or 3 lingering 4 o'clock appointments. And then we're sitting there all afternoon kind of shuffling paperwork, getting other, back office stuff done, only for those to cancel, an hour before the appointment or not show. So it really kind of upended stuff. And that leads to, why in some places, so then we saw less patients initially. Our employees, had less hours because we start cutting off and going home early. Not in my office in particular, but that's why some like ER was a big thing. As much as everybody's talking about ER in the hospitals and they're getting overloaded, the flip the script was those same people with abdominal pain, heart attacks, probably some stuff that didn't need to come to the ER anyway if they had proper access to care. They weren't coming. So you were really just getting the people who are, I think I got COVID or I actually have COVID coming to the ER. So it really did do an upend. And I'll tell y'all lastly, PPE is still an issue. When I went to reorder this last time, I think gloves, it was hard to get just regular medical gloves. So just like in the stores when you can't get Clorox wipes or toilet tissue or paper towels, it's a moving target and it changes. So the first everybody wanted the mask and like the doctors, the drapes we wear for surgery and stuff like that. Now masks, in addition to those things being hit or miss, now you almost can't get gloves. So it's just a moving target.
So you a shift on a lot of different fronts, as it relates to your work. All right. So Ms. Scott, you were able to join us, introduce yourself, and we're just answering the question, how have you been personally affected by COVID-19?
Okay, can you hear me?
We can. Yeah.
Can you hear me?
Yes.
I can't hear you guys. You're breaking up a little bit. So I want to apologize. There's quite a bit of traffic in Baton Rouge right now. and so I'm still trying to make my way home. My name is Nicole Scott, and I'm a registered nurse. I work at Franciscan Missionaries of Our Lady University as an instructor, and I also work at Baton Rouge General Mid-City as a registered nurse on the COVID unit there. I've been there since Mother's Day weekend. For the first couple of months, I was there almost every weekend. I did a stint of 32 days straight where I was at the university Monday through Friday, and I was at the hospital on Saturday and Sunday because of the shortage of nurses and just the need to be there. So it's been interesting. This should be a good conversation. I'm glad I'm here. But yeah, it's been quite the experience being a registered nurse during this time.
Okay, thank you, Ms. Scott. All right, Pastor Domain, what about you?
First, I'm doing well, and I'm appreciative again to be a part of this conversation. Like everybody else, life was upended. The work that we do, we gather people for a living, and had to stop all of that for some months. In fact, we are still not coming back into the sanctuary together now, so that's very different. And I'm sure Pastor Rowe will attest to, as a shepherd, you're used to touching your people and being a part of their lives. And so it is kind of difficult that, you might hear that something happened in the life of a parishioner 2 or 3 weeks ago, and you're trying to respond now. Personally, we try to do what we can for community and for parishioners, but we still have our personal issues to deal with. And so it has been a journey of ups and downs, I think is the best way to describe these last few months.
Thank you, Pastor Domain. Pastor Rowe, we'll yield to you.
I have a very multifaceted journey with COVID. So as it was first starting, I had the complexity of trying to navigate both business and ministry. So I'm bivocational. I'm one of 6 partners at a consulting firm that consults credit unions around the nation. So we were trying to work through what our business model was going to look like in COVID. Thankfully, we were all, most of us anyway, probably 60% of our staff were already working remote. But just thinking through the complexity of what is this going to mean for business? Are we going to see downward pressure on our trends? Working through just strategic plans, contingencies, all of this. That was a headache in itself, right? And then there's the ministry aspect. So when I tell you I'm coming into it extremely stressed because I'm having to try to figure out a new world over here. And in ministry, as Pastor Domain said, we're in the business of gathering people and realizing really quickly that we were not going to be able to do that, trying to pivot and figure out pretty rapidly what it was going to look like for us to operate in an online environment, not only in trying to have excellence in presentation, but what was it going to look like for us to try to maintain connection in this environment. And so that was super complex. I was feeling very drained. I haven't taken the antibodies test, but I have enough reasons to believe that I actually had contracted COVID on the front end based upon the number of people. And I would tell you, actually, the day before the first COVID case, we were having a service in New Orleans. So we have been launching a campus in New Orleans, crazy momentum's building there. We have over 300 people that night. And that week leading right after that, a lot of people just ended up being sick of what we now know for us was likely COVID. One of my great friends, my best friend, contracted COVID. And so he and I got sick around the same time, me knowing that he was sick, I was sick. I have every reason to believe that I had it based upon, I felt I was fatigued because this is complex, right? And I felt I'm having this shortness of breath because I'm stressed out. But I now know better, right? But in the midst of all of that happening, very early in the journey, my mom actually contracted the virus. And so the irony of it is I remember calling my mother early on the journey and calling her. At the time they were saying, it's elderly people that are passing away from it. And it's people with underlying conditions. It was the way it was positioned. There was no reason for me to feel that my parents were a real threat based upon their ages. My mom was 56. My dad at the time was 58. He's now 59. He's had a birthday since then. But I called my mom and I said, okay, I gotta start talking to my parents. They're getting older. Like, tell me what's going on with you also. And she said, your dad's fine. He's pretty much gotten his cholesterol under control. And she was like, the only thing I have is a really mild case of high blood pressure. But she said it's trended so well, like I'm almost off the medication. So she wasn't like this drastic. She didn't have this drastic issue. Fast forward, long story short, my mom ended up contracting the virus, and it's so many steps of that I can remember that are just completely horrifying. But I remember the day in which she went in the hospital. It was March 27th. She went into the hospital, and the very day she arrived at the hospital. First of all, let's talk about the fact that she took the test on a Monday. We never got the results back from that test. We never, ever, ever got the results back from that test. She was presumed positive at that point because she had taken the flu test and the strep test, and both had come back negative. By that Thursday night, my mom was coughing up blood, and so she needed to go to the hospital. She actually had to go to get X-ray the following day. The first hospital she went to did an X-ray, said they saw nothing. Everything's clear, but her oxygen just kind of low. We need to transfer her to another hospital. They transfer her there, where they were like, I don't know what they said they didn't see, but we see pneumonia in both of her lungs, and it's viral. By that night, my mom was placed on a ventilator. I'm gonna be honest with you, I had no idea really what a ventilator was, which most Americans really didn't. Like, I had no knowledge of the fact that my mom's gonna be on a ventilator. That's gonna mean she's gonna be sedated. She's going to be paralyzed. She's going to be unable to communicate, because our big push before then was to make sure my mother received her cell phone, because she was a very thorough communicator. And even though we couldn't be in the room, we wanted to make sure that we had information that we could not get from her, because when she was placed on the ventilator that night, we lost all communication, having to rely on, at that time, 2 calls a day to let us know how she was doing. 2 calls a day that didn't always come on time. We were thankful there was one nurse that just really had a lot of empathy along that journey. My mom was in the hospital for 11 days. Many people saw it because we were very public on our journey and believing for her to be healed, and we invited the community in to pray for her. Our family is very bold in our faith, so 8 of those 11 days, although we could not go into the hospital, we met on the parking lot, social distance, and walked and prayed for an hour every day. That's how hard we believed for my mom. We went through an 11 grueling day journey until we lost her on April 6th. And so for me, COVID has had a substantial impact, one that I will never, ever forget. Many people will get to move forward from 2020, and it'll be a stain on their memory. They may not like it, but they'll get to move into what will be some level of new normalcy at some point. Well, I believe it's far away for us, probably about 18 months before we see a return to what we thought to be normal. It's a normal I will never get back. So for me, it's had, and losing her so early in the process brought a different weight to COVID for me. And so everything from business to ministry got that much more complex. I've been trying to navigate losing my 56-year-old mother. If you saw a picture of my mom or knew my mom, you know that she was a vibrant, she was not a decrepit, sickly woman. She was a vibrant woman that was here today and gone tomorrow because COVID came. And I will say this one thing, and I'll turn it over. One of the things that our family immediately did was take control of the narrative. And the reason I say this, because I think it's important for people to understand, we see numbers and we can become desensitized to those numbers, but though every number is a person, every person is connected to a family, every family then has to deal with the trauma behind it. And I'll never forget the next day, the day after my mom passed, read the newspaper, which I shouldn't have done. And it was talking about the people who had died the day before. and they talked about 2 people in their 70s, 2 people in their 60s, and a 56-year-old woman. And in that moment, I realized there's no way that I'm going to allow my mom to be a number. You know, her legacy was so much larger, and our family worked valiantly to take control of the narrative of her story and who she was. But it's been very personal and continues to be very personal for me.
Wow. Really a heart toucher there, just thinking about what you've had to navigate. And when you talk about reading that newspaper article and it's saying a 56-year-old woman and you knowing that that's your mother, how it just kind of stings your heart, that it's your mother, but to some, it's just another number we see in the statistics and the data every day. And really, how do we put a personal face with those numbers to realize this is somebody's family member, this is somebody's loved one whose life is now gone as a result of this virus. And truth be told, we don't even get to celebrate their life in a traditional sense as we typically would as a result of COVID. And so I'll come to you, Pastor Domain. What has kind of been the response of your congregation when you think about not being able to gather, and not just for times of celebration of life, but for other events? How has your congregation responded to that? And kind of how have y'all navigated this season?
It has been difficult to accept the change. And as we were talking about earlier, I don't know if we will ever go back to what used to be. There will be a new normal for operation and protocols and even how we enter and leave, you know, our gatherings together. I will say, though, as it relates to celebrations of life, one of the things that I recognize is that the grieving process was compounded by the fact that we could not gather in our traditional ways and touch one another and help one another heal. And so one of the things that we're going to do here, and I've talked to others who plan to do the same when the opportunity presents itself, and we are further along in this process, we'll have a special service where we will try to all of the members and family members that may not even been a part of our faith community that have gone home, and you had to invite 10 people to a service or limited to a graveside service. So that has been probably the most difficult part of ministry. That and finding out that there is a member who has contracted the virus, and I can't go see them in the hospital. I have to rely on phone calls and my family tells me. So that's part of how we're trying to adjust to it all.
Yeah. And so as we think about just the stark reality of COVID and the lives that are being lost, Dr. Andrews, I want to come to you. What can we begin to do as a community, especially the African-American community, to help decrease our chances of getting COVID, right? Is there such a thing? I mean, we've been told to wear masks. We've heard about African-American community being more susceptible due to underlying health conditions. Can you speak to some things that many of our viewers or those who will view the stream later can begin to do right now to try to protect themselves from COVID-19?
Yeah, I think you hit several of them on the head. Obviously, the social or spatial distancing. Number one, none of this is new per se. The social spatial distancing, washing our hands, hand sanitizer, wearing a mask when out in the public or around people that are not in your own household. I think those are the number one things that we all have to keep doing. I think the biggest thing is not getting COVID fatigue, because here we are now 6 months into this, and Pastor Rowe is absolutely right. On the call I was on earlier today, it was about COVID as well. Nobody sees the end to this before next summer. So you have to look at, we're going to have been in this thing, like he's saying, Pastor Rowe said, 18 months. But then in addition to that, that's just hopefully when the trend has gone down. But that doesn't mean we're back to life as it was. I think Dr. Fauci has probably been, with the CDC, the large, and National Institutes of Health, has been the biggest in saying that, wearing a mask is going to do way more than this vaccine that we hope one day comes out and in mass quantity. Some people are thinking that if it was the vaccine we're waiting on, that, we're sitting there, okay, by the time you can get enough doses, give it to enough people who are willing to take it, you're talking 2024 by the time the vaccine would do it. So it's really a multifaceted plan, staying aware, doing all the mitigation measures that we know of. And then obviously if the vaccine comes out and is found to be safe and efficacious, then obviously take it, which would be, it's going to be an issue then. I'd say in addition to that, what we need to look at is, for some reason we don't know. And like I said in my earlier conversation about COVID today, I mean, for whatever reason, with African Americans making up only about 13.5% of the population, for some reason, we're 20%, 25% of the deaths. And that's the thing, I tell people, you almost have to look at it like you can make numbers say and do what you want them to. But I tell people, because it's a bigger conversation, you almost have to look at it like we look at the criminal justice system to explain the numbers. You can't just say, oh, Black people, we're all criminals and, they get arrested at these high numbers. Because if you look at a gross number, then no, we don't get more arrested, unfortunately, killed by police officers or anything in numbers. But when you drill it down to, hey, we just a little bit over 10% of the population, and the kind of numbers of people who unfortunately have interactions with the police, end up in prison, it's kind of the same kind of way you have to look at these numbers. How can we be so small, so to speak, people of color really all together, but then we're making up the majority of people who get it and then unfortunately subsequently pass away. I don't want to be a conspiracy theorist on your show, but it's just amazing. Is it the perfect storm that our health was just that much, health status was that much lower? If for some reason in our communities we live closer and tighter spaces to other people, is it because we're frontline workers in our community that, you have to go to work? You're, what we call essential workers, all the way down to people working in the grocery store and the garbage collectors. Oh, y'all essential. And they ain't getting paid like they're essential. And they ain't getting many bonus or perks for being essential, but they're essential, so they say now. But it is, I look at it as almost, if y'all are old enough, Pastor Domain, if they're old enough, it was a movie out in 2000 called The Perfect Storm. And I'm not getting much into the plot of the movie, but it was about a storm. We're getting enough hurricanes down here in Louisiana this year. But is it, the health status, where we live, where we work, that we're interacting with so many people as a community, then we come back home, to our family members, if we live in multi-generational housing or anything like that, that we then spread the disease to each other. And then it gets confounded by, our insurance, or lack of insurance, or funding source, Medicare, Medicaid, whatever access to care might be, that it puts us, further back in line. It's almost like, that little story where, hey, we're gonna all run a 100-yard dash and, everybody else gets a head start. Then we start so far behind people that when this hit, we were more susceptible to get it and die from. And the conspiracy theory was, unless this is some kind of engineered virus, in some kind of way it can pick and choose certain, genes and conditions that it affects more than others. And we don't know that, but I don't know a doctor, honestly, at this point that I've spoken to that hadn't said in the back of their mind how odd this is, the way the virus has spread and the people it's affecting the most. And it could not be that, this was engineered. And they're not saying it was intent to release the virus. Nobody's saying that. Somebody intentionally released it. You also might remember back when HIV/AIDS came out. Excuse my language, but it's probably still a conspiracy theory. Was that engineered in a lab somewhere and then, injected in monkeys in Africa and so on and so forth, and then subsequently spread to humans. So I don't know. We're not turning this into some sci-fi thriller, but it's just interesting. Yeah. And it's a novel virus, and just nobody knows how a virus could appear, naturally and wreak so much havoc.
So you said a term I want to dig into for a few moments about becoming COVID fatigue. And so to Pastor Domain and Pastor Rowe too, your faith communities who are becoming, fatigued about just hearing this on the news every day. And truth be told, some folk are just tired and ready to go back to the way life once was, right? We are now at 75% as a state in phase 3, and people are just have ventured back out. How do we, I guess, process that as a faith community where we don't become COVID fatigued, but we can still believe that God is able in the end to work this thing out on our behalf? Either one of you want to dive into that?
I'll yield to you, Pastor.
I was about to do the same thing. I will say this. One of the things that helps me in the journey of helping lead other people is always embracing my own humanity, right? So I live in the reality of the fact that I'm tired of it, right? So I will never tell anybody like I'm very tired of it. It has done a lot. It has exhausted me. It's taken a lot from me. It's been super complex to think through it, navigating back into the building and the space. The encouraging thing that I get is that, and this is so interesting, the Lord took me in this journey this Sunday. I preached this message and I was super aggravated with God, and I was letting him know, right? As a pastor, I was letting him know. So, and guess what? Just like your children get aggravated and they let you know you still love them, God still love me. The man of God, I was just like, you just been to me. I don't know what you've been doing in this season, but I don't like it. And if you knew this was coming already, this is something you could have done something else. You could have stopped this. I don't like none of this that's going on right now at all. And so God spoke these words to me and he said, I'm still in control. And I'm like, well, first of all, I don't want to hear that right now. And second of all, that's the most cliche and churchy thing that you could at least been innovative in talking to me, God. Like, I'm still in control. You done said that all, And so God was like, now I need you to understand, still meaning not moving, in control meaning something I have authority over. And so God said, I am not moving in my authority. I still am guiding this. And God had to remind me of a few things. He said, the promise is still the promise. He took me in the scripture where he said to the disciples, he said, let us go and cross over to the other side of the lake. They get in the boat. The Bible lets us know soon after a fierce storm comes, right? All of the words matter. It says soon, which means Jesus already knows that right up here, a storm is coming, right? And it is not only a regular storm, it's fierce. Now, he had already promised what was on the other side, even before they began to navigate it. But if he said, hey, look, we about to get in this boat and we're gonna go right through a hurricane, but we're gonna get to the other side, most of the people would have said, I'm not getting in this here boat. You could go in that boat by yourself, but I'm not going through a hurricane. And what God was reminding me through the scripture, he said, the promise is still the promise. That what he said to them in the beginning is, let us cross over to the other side. That was the declaration. And then he says to me, the storm is not a real threat. A lot of times we see the storm and the storm appeared to be a threat. What was so frustrating, I know had to be aggravating for the disciples, is Jesus had the audacity to be sleeping at the back of the boat. And the Bible says in one translation, he had his head resting on a cushion. Have you lost your mind to have your head resting on a cushion? And we are in the middle of a storm, right? But for Jesus, what he's looking at is, you are intimidated by this storm, but it's not a real threat. I already knew that we were going to travel through this storm before we ever begin to navigate it. So then he says to me, Ronaldo, reframe your perspective, because I want you, if I say the promise is still the promise and the storm is not a real threat, then your mindset has to be reframed around the fact that I am still in control. And get this, all he was waiting on was for the disciples to engage him. The Bible didn't tell us that Jesus woke up and was startled. It actually says he woke up, he rose up and he spoke, peace, be still. He spoke. He was not startled by what was happening. He was only waiting to be engaged. And so what I have gained from this, and where we landed in this message, is that God told me the results will blow our minds. And I will tell you, over this last week, I have watched God as he spoke this to me last Tuesday, so a week ago today. I have watched God, for me personally, respond to the most obscene things. Like I say one thing in the atmosphere, and then the same day, God, and it will sound crazy. Even something just today, yesterday, I was flying out and I had my Beats headphones on, and I've worn them so much they just worn out. And so I took them off, and somebody said, "You got white stuff on the side of your face, and it's because it's coming off, you know." And I said to myself, I really need to get me a new pair of Beats, right? I just say this out loud yesterday. I get to the event I'm at today. They hand me a gift bag for a gift that they had purchased for me. And what is the gift? A pair of Beats. If I go through, there's two other stories that I can't tell because it will be revealed soon. That over the last week, I said something out loud and God responded right away. What he was showing me is, I know what you're walking through right now seems overwhelming. I know that it's annoying. I know that it's aggravating, but I already knew this. And what God is showing me, and even through this, is I'm still listening to you. I still hear you. I'm still ready to respond. And my favor is still on you. And that message is not just for me individually. I believe that is a collective message that God is saying, I'm still in control. I knew about COVID before you knew. I knew about this from the foundation of the earth. I'm not surprised by anything. We may be aggravated, and I am definitely annoyed with God about it. I am annoyed. I am mad. I'm like, if you knew about this, you should have done something different. But what I have to hold on to is that he's still in control, and the promise is still the promise. It has not changed. We don't always understand what God is doing in the now until we get to the next. Many times we have greater revelation and clarification on why we are navigating the current journey when we can look at it through the rearview mirror and have retrospective thoughts. And I believe that some years from now, we'll be able to look back and say that there were some foundational things that God did in this period that even though we didn't understand and it didn't make sense, and the storm was surrounding us, the storm that wasn't a real threat, we'll see when we get to the promise why we had to go through the journey.
Man, you just said a whole lot there. I wish we had time to dissect. And I see Pastor Domain just over there itching.
I'm thinking I missed the good sermon this weekend. I should have been with Pastor Rowe.
Exactly.
Yeah. But you want to respond, Pastor Domain, before?
I would. I heard Dr. Andrews say something, and I'd like to add a little bit to that too, because church people, we can sometimes be hyper spiritual and miss what God is doing. I would say, man, first of all, listen to the medical professionals and not politicians, because their job is to keep the machine going, right? And the medical professionals, their job is to keep us living. So please listen to those people who know better. And I'm a pastor, so I hope I'm not offending anybody. But I would even say, if your pastor is talking, as we say, talking crazy, still listen to the medical professionals above, listening to the one that says, if you get it, I'm gonna heal you, right? Because that's gonna get a lot of us in trouble. And so that's what I'd like to add. You asked about how we're helping people to deal with this in the midst and not become fatigued. One of the things that we try to do is to reach out through like old school phone trees, right? And emailing, and we use robocalls and any technological advancement we can use to try to reach our congregants. We do so. I know that I can't do it all. And so we have teams spread out all over, just trying to encourage one another to say, hey, I'm thinking about you. Do you need anything? We do the drive-by thing. I don't know how effective that is, but we just try to touch one another as much as we can, not literally, of course, to make sure that we're all doing well and not becoming overwhelmed in the midst of all of this.
Yeah. And so you mentioned about who to listen to, right? Make sure we're listening to the right people, God and medical professionals. And so we were able to get Ms. Scott on. Ms. Scott, and you mentioned that you had worked in the ER during coronavirus and spent some 30 days straight there. And as this virus has evolved, and it appears to be evolving almost every day, what is it that we need to know for our viewers? What are some things that may have evolved recently, or some things that are still the same that we need to know how to protect ourselves, or some new things that, as it relates to the virus, that you can share with us?
Okay, so I will say I wasn't in the ER for 30 days. That would be I I work at the university, so I work there Monday through Friday, and I work at the hospital on Saturday and Sunday, and I work on a COVID unit primarily. So the the standard precautions have not changed from the beginning to now, and even prior to COVID, it's always been best practice to wash your hands, to use soap and water, to wash them for at least 20 to 30 seconds, sing a song if you have to. Um, it's always been best practice to stay home if you're sick. It's always been best practice to cover your sneeze, cover your cough, you know. So those things are always going to be the same, and those things are still extremely important for people to do. One of the things I noticed, I was watching something on the news a couple of days ago, and one of the reporters that was on, she was an Asian lady, and she was talking about how when she was younger, back from wherever she's from, she was sick one time, and her grandma, she was little, her grandma put a mask on her before she left to go to school. And their belief is that it's just not polite to go out into public and spread your germs on other people. And I, you know, just from a humanity, from a human perspective of treating everybody the way they should be treated, we think about it from that perspective. Is this polite? Is it nice? You know, what's the gracious thing to do? What's the, you know, the right thing to do? And continue down that path, we'd all be right now in a better place than we are, quite honestly. So a lot of what I've seen in the hospitals has been our older populations that already have comorbidities, and those are typically the ones that have not done as well as we would like. Um, and it does get really hard to, you know, continually watch that happen. So, you know, we just kind of we plead with y'all to just at least do those things: wash your hands, wear your mask, because it's the polite thing to do. Cover your sneezes and coughs. If you're sick, stay home. Those things are going to, you know, help mitigate the situation a lot faster. And now that we've had COVID for as long as we've had COVID around, we can actually see where there are places that have used those measures and have much lower numbers than we have. So, you know, they haven't had to do anything extravagant. As we know, we don't have, you know, outside of a trial, we don't have a vaccine, right? So no one anywhere that we know of right now is just widespread, you know, vaccinated with this COVID vaccination. So they must be doing those you know, baseline things: wash your hands, cover your mouth, all of those things, right? So, you know, we live in a society where we're used to being able to do whatever we want, go out and wear whatever we want. And we're not used to having people tell us what to do with our bodies. And so that's probably a lot of the issue there is, you know, you can't tell me what to do. You can't tell me to wear this mask. And it's really not about that. It's about our neighbor. It's about loving our neighbor. It's about doing what's best for each other and coming together as a community and making sure that we hold each other accountable as well.
Thank you so much. And so, our last few moments here, you've given us some great tips and advice that we need to remember and not become fatigued doing: wearing the mask, washing our hands, staying socially distant. And so, to each of you, kind of as we depart, you'll take a minute or two and just share your heart with the people who are listening and watching. What is it that, from your perspective, from your vantage point, whether personal or professional, that you kind of want people to know as we begin to continue to live in this COVID-19 reality for God knows how long? So, Ms. Scott, we'll come back to you first. If you'll take about a minute or two, go to Dr. Andrew, Pastor Domain, and Pastor Rowe.
I think she's gonna give me her turn again.
So go ahead, Dr.
I'm back. I'm sorry.
Oh, darn.
Okay. All right. So a couple of things I would like to say. First of all, to all of our people out there, not even just the medical professionals, but everyone, remember that it's very important that you get your rest. You cannot get better if you do not rest. Your mind cannot heal if you don't rest. You can't de-stress if you don't rest. You have to lay down. You've got to
Uh-oh.
All right, so we
All
lost
right.
it.
I'll jump in if she comes back. We can pick her back up. You know what I'm gonna say is I really like the way Miss Scott just the things she just said, because it's weird, kind of paraphrasing it. You know, I learned everything I needed to know in first grade. I mean, if we would just do the right thing and be kind and gentle, and I'm talking about wearing a mask, staying away from people, these quote unquote nice things, we could be so much further down the road with this coronavirus than we are. And I don't know a simpler way to put it. So I really like the way that she said that. You know, secondly, I hope she can still hear us. You know, I think she's downplaying her role a little bit. I guess she was saying that she worked 30 something days in a row, which would have been all the weekdays at the school and then the weekends in the hospital. But I mean, we have to applaud her, because I know people who quit jobs, even in this economy, because they were not going to work on a COVID unit, and were not willing to put their lives at risk. So now that she's back in here, she's not, and I applaud her wholeheartedly for that. Because, you know, we definitely need nurses like her and doctors who are willing to do that. You know, the environmental services people in the hospital, you know, to come in and clean up the rooms and turn them over. So what I would say, you know, personally, so thank you for that, Ms. Scott. What I would say is, first and foremost, if you could stay at home and stay safe, you and your family, I think that's the most important thing. You know, here in Louisiana, we're obviously expecting yet another hurricane coming in, blowing all this stuff around. But then we're going to get a cold front as well right after it. And the biggest fear is, and if you look at a map, depending on what news station or what reporting service it is, you know, I think it was 10 days ago, there was like no green state. If the map was either green was stable, orange, then red, there was no green state in America. Everybody's numbers were going up. But if you kind of took a cross section of America and you just put a line and started in California all the way over to maybe North Carolina, just straight across, you know, the mountains, the plains, Tennessee, so on and so forth, everything north of Tennessee, where it was already starting to really get fall and cooler weather, their numbers were skyrocketing. And you were hearing places, you know, it's weird. It's almost the inverse. The places that didn't have spikes before, and either they got COVID fatigue, since that's the term that we've been using for this call, it's like they weren't prepared and they didn't learn from California or from New York or Louisiana or Florida, where there was earlier previous spikes. Because now you had the Montanas and the Dakotas and, you know, the Rhode Islands and places that had low numbers at first, but they're now spiking and peaking really to numbers they haven't seen before, because they weren't prepared, because I guess they let the guard down because they missed some of the early, you know, coronavirus infections. But now it's cold outside. It's cold outside. People are going to be congregating more indoors, and it becomes a problem. And if I had to say one last thing, so I'll make sure everybody can get some in, I think, Reverend Jonathan, you brought up, you know, most of Louisiana is phase 3, and a lot of states are, you know, phase 3. I'm going to say I'm more concerned about phase 3 and going inside a building or restaurant than I was, you know, 2 or 3 months ago. Now I really don't want to go, because let's just take a restaurant as one example. If you're phase 3 at a restaurant, that means you could be up to 75% capacity. Well, what is 75% capacity? That means just all your tables are full, but nobody can wait out in the lobby for a table. I mean, that's, if I'm a busy restaurateur, that's 75% to me. I have every table that I have a waiter to attend to, but now I'm just saying you can't wait at my bar or you can't wait out in my lobby until your next table is ready. So, you know, that is real concerning. Obviously, the places that get colder faster and stay, you know, that way have a real winter longer than we do down here, you know, it's going to be a real concern. And hospitals volumes even here are picking up and spiking. And if I'd say lastly, if you look at historically 100 years ago, 102 years ago, with the, we're going to call it the flu pandemic, because it really, Jonathan, I'm not trying to be a conspiracy theorist. It wasn't really no Spanish flu, but we know that's what they called it. It started in Missouri, but we won't get to that. It was the second wave where everybody died. It was like, 1 million or so people died the first wave. It was the 30 million that died the second wave. So if you go back and look at the history, it's those later waves that the deaths start rolling in. And I think lastly with us, doing all those measures that Ms. Scott mentioned and I mentioned earlier about a mask and washing your hands and distancing and so on and so forth. I like to, throw in a flu shot. If you're not afraid to take it, take your flu shot. Because if you come in a month from now with cough, cold, and fever, and you hadn't had a flu shot, you're going to still get tested, but we ain't going to know what you got.
Yeah.
Point blank. You start talking about coughing. Oh, man, you got the COVID. I mean, hey, can you go somewhere else? Don't come up in here.
We appreciate that, Dr. Andrews. That's a good knowledge for us. Yeah.
It's true.
Pastor Domain, Pastor Rowe, and our final minutes here. If you take about 90 seconds, give some closing remarks to the people, what your heart is. You're on mute, Pastor Domain.
You want me to take his turn too, Reverend Jonathan?
No.
I'll just say, don't get tired of doing good, man. Do what's right. Follow the instructions that we've received on this webinar tonight. And don't forget, even in the pandemic, justice is still right. We can't forget to do what is right and make it right as God allows us to. So do justice, love mercy, and walk where God walks.
And I'll add, so that I don't repeat anything that they've said in redundancy, be kind to those who are hurting during this period and continue to remember that there are people who have experienced real loss. Don't forget about them, and being in this journey and having to navigate grief. I know how easy and how quick it is for others to move on. But the reality is, as our communities and even as the nation, are hurting, although we see this number of deaths, you got to think about the millions of people connected to those who have died. And we need to keep them here. I'm concerned about making sure we continue to care for people, that they don't lose hope in the middle of grief, right? And self-select to leave this earth as a result of it. So be sure to be kind and present with those who are around you, who are hurting as a result of that. I believe that is something that's super necessary. And take care of
our panelists, to our viewers, thank you so much for joining us for tonight's discussion as we looked at stories from the coronavirus. And all of us have our own unique story, whether it's personally touched us through the loss of a family member, or through somebody we just know who contracted the virus, or just having to readjust our lives. And all of us have had to do that in some form or shape over the past, has it been 6 months, 9 months? It seems like it's been such a long time. And we still
8-9
months. And so don't grow fatigue. Keep doing what we're supposed to do, those simple things, as I said, as we learned in early grade school, to make sure we keep ourselves safe. So you can continue to check this campaign out at www.exerciseyourfaith.org. A lot of resources there to help you navigate the COVID-19 pandemic to make sure that we can live healthier lives. So our panel, thank you yet again for being here with us tonight. To all of our viewers, God bless you and have a great night.